Recently, I've come across this lady. I think her name is Christine or Catherine, something like that. Um, I came across a story on TikTok.
Oh, okay.
But before, I've read something in the paper about her story. She was in, I think it was Spain. She and her family was enjoying holiday, and she got a stung or something like that, and they didn't pay any mind. But when I looked into her story deeply, listening to her talking about it directly, you get to understand that she had a untreated infection, and that lead to having sepsis.
Sure.
So, can you walk us through what is sepsis and how can we get diagnosed? How can we identify?
Okay. So sepsis, for all doctors, nurses and healthcare professionals, is a really important topic. It's actually a life-threatening condition that occurs when the body has an extreme response to an infection. Okay. So instead of just fighting the infection, the immune system goes into overdrive. Yeah. And it starts damaging its own tissues. So imagine your own body damaging your own
So
tissues.
is that like what's it called? Is it autoimmune?
So lupus is an autoimmune condition, and that's to do with antibodies produced by the bone marrow,
Okay.
which cause like a chronic illness. So the person might notice a little ache in the right knee one week, a little ache in the left shoulder the next week, and then they may ignore it, or they may choose to go to their GP, or they may choose to go to A&E, and the doctor might write it down and say, take some paracetamol, ibuprofen, but then 3 months later it occurs again. So that's like called insidious. It comes on gradually. Yeah, lupus does. It's very rare that lupus hits with the full-blown serious impact, such as kidney failure, straight away. There's warning signs. So people again need to listen to the bodies, and if you've got symptoms that aren't right, that weren't there before, speak to your doctor. Sepsis, on the other hand, though, is this overwhelming. It's an infection. So the body goes into overdrive and starts damaging its own tissues and organs, and it gets to the point where it's life-threatening.
Right.
But if it's treated quickly, people can actually avoid getting the serious complications of sepsis and the potential, risk of death from sepsis.
Okay. I was looking on the WHO, and they have a data that published from 2020 that says 48.9 million people were diagnosed with sepsis, and 11 million was sepsis-related death. To me, as a Jamaican, that never used to really hear about sepsis, come to the UK and hearing about sepsis, it's a regular common thing in the UK to hear that someone has been diagnosed with sepsis or someone that passed from sepsis. So when I've seen this alarming figure to know that so many people died from sepsis, like, can you just like give us before, because you were supposed to list some signs, but
Did I forget to give you the signs?
yeah, but before you give me the signs of the sepsis, like what are the mortality rate for sepsis?
Well, as you mentioned, that World Health Organization study, which collected data from 2017 but was published in 2020, because it takes time to collect the data, so it's always a few years later.
Yeah.
The mortality, so that's sort of, if you look at the fact that there were 48.9 million cases and 11 million deaths, that's like 1 in 5, 1 in 4, 1 in 5 of people that get sepsis can actually die from it. Now, we're looking at the whole world, and obviously you've got different countries with different facilities and different access. And although you never came across it specifically in Jamaica, I suspect there were cases happening in Jamaica.
Yeah, there were cases, but growing up, because when you get a cut,
Yes.
you know, it's simple like you just get some alcohol and pour on it and you're gone. But
Yeah.
I realize sepsis is just even more than that.
Oh, much more.
Yeah, you know,
Much
but it's there, but I don't hear about it like how we hear about it here in the UK. It's like when my knowledge was open to sepsis was when I'm in the UK.
Okay, yeah. So you may be thinking of sepsis because every time you see an ambulance drive past,
You see the sign sepsis,
sepsis
yeah.
that word is on there.
Right.
You know? And again, we've had this COVID pandemic, which has heightened people's awareness of disease more than ever before. You know, suddenly talking about disease was an everyday occurrence in our lives during that pandemic.
Mm-hmm.
So people are more interested in health now since the pandemic, and, you know, some of the people that died during the pandemic would have actually died from sepsis as well. It's an overwhelming response by the body to an infection, and that's what COVID was, you know.
Mm-hmm.
So, yes, it's a high mortality rate, and the thing about it in medicine and nursing is that we treat it as one of the top medical emergencies, you know.
Right.
So we have training on it, and we're told about the signs and symptoms and how to respond.
Mm-hmm.
So we have to think sepsis. So if we see a case and we're suspicious, we have to think, is this sepsis?
Mm-hmm.
We have to speak sepsis. So we have to say to somebody else, I think this could be sepsis. You don't just keep it to yourself.
Mm-hmm.
And then we have to act on it as well.
So do you think in the NHS
Yes.
or in the medical industry, they
Yes.
pay enough attention, or they've been trained the right way? Because I've heard about cases where, like this lady, she brought her son to the doctors because he was having high fever,
Yeah.
and they just give him some paracetamol or whatever, and they send him home, and they call and it's like the fever is not down, what should we do? And they said just give him a next dose.
Yeah.
It reached the point where they had to take him back to the children's hospital, and they just rush him up, give him whatever, and send him back home, and within a couple of days he passed, unfortunately, and
it
when
was
they
sepsis,
and
yes.
it was sepsis. So do you think that the medical team are, you know, properly trained, every one of them, or, you know, to analyze it?
We talked about burnout, and we talked about, I said there could be different professions that this could affect. And without a doubt, you know, doctors are human,
Right.
nurses are human, and the resources sometimes are such that people might feel burnt out.
Mm-hmm.
And we talked about burnout now as a potential risk factor for sepsis, so we talk like full circle.
Right.
So my impression is that yes, it's the training is good.
Mm-hmm.
The facilities in the UK are exceptional, even though the resources, you know, the staffing may not always be at the top level.
Right.
But if you take yourself to other parts of the world, you're not going to find a hospital every 10 miles. You're going to have to travel 30, 40, 50 miles. And when you arrive, if you don't have medical insurance or money, you may not get treatment.
True.
So you've got to bear in mind that we're in a first world country here.
Mm-hmm.
And we get training. We have mandatory training on certain things. And sepsis has been one of those high-level, important areas of training.
Mm-hmm.
So I'd say, in short, the answer is yes. But like with anything, every single case has its different factors. You know, the factors that cause that case not to be as successful as the next case.
Right.
In terms of the outcome. It may be that the individual has a lowered immune system to start with, you know.
Mm-hmm.
So even as a child, you can have a lowered immune system.
Mm-hmm.
It may be that the medication was not at the right dose.
Mm-hmm.
It may be that they weren't examined. Maybe it was telephone rather than face-to-face.
Mm-hmm.
It may be that there was a delay in getting to the hospital. Traffic or road traffic collision or some other thing may have stopped the person getting to the hospital at just the right time. You know, sometimes if you come in half an hour later, this could have been a different story.
Mm-hmm.
So I'm not denying there may well have been multiple interactions with healthcare professionals which didn't, you know, which perhaps did not recognise the sepsis.
Mm-hmm.
I think you can ask me for some signs and symptoms of sepsis.
Yeah, because I really would want to know, because, you know, you wouldn't want to pass the signs and ignore them, because, as I said, as a Jamaican, if certain things happen, we just brush it underneath the ground and, like, you know, try and sort it out for ourselves. You know what I mean?
Yeah.
So how can we identify the signs and the symptoms of sepsis?
Okay. So it's actually called a hidden killer sometimes, because it's those symptoms, as you say, you want to just brush them to one side and think, I'll deal with that tomorrow, you know, I'm not going to worry about it right now. So it can be a fever. So fever is a very important one. Or it can actually be a low body temperature as well. So there's a normal range of temperature. And if your temperature is too high and won't come down, or too low and won't come up, that can be a sign of sepsis. Rapid breathing, so or difficulty breathing, you know. It can also be that the person's confused or disorientated. So I don't know if you've ever seen that, but you know, people sometimes who have an infection can actually be quite confused.
I've never seen that
Even
before.
a urinary tract infection, particularly for older people, can cause them to be confused. Sometimes the first symptom we see of a urine infection is the person's more confused than normal.
But before you carry on, what would cause the confusion though?
Okay, good question. So I guess it's the actual process of the infection on the whole body, because an infection is not always just the cut.
Yeah.
It's getting into your bloodstream. Even with a urine infection, your body's reacting to that infection. It's trying to fight the infection off.
Okay.
But that's a good question, and I think there's a more technical answer than that.
Yeah.
Involving hormones and enzymes and things like that.
Yeah.
But as I say, particularly in the older people, sometimes when the first signs of an infection is the fact they're confused.
Okay.
And their relatives come to recognise it and say, oh, she's confused again. I think it's a urine infection. But anyway, so confusion or disorientation. They can have a clammy or sweaty skin. Yeah? Can you imagine cold, clammy skin? Or very sweaty skin. The skin doesn't feel the same as normal. And then there might be an extreme pain or discomfort as well. In children, they can also have convulsions, like seizures.
Right.
They can have cold limbs, so the body's hot, high temperature, but the hands and the feet are cold.
Okay.
We call it the peripheries. They may have difficulty walking, or they're not eating as well.
Oh.
So when a child's off their food, sometimes the parents
You
worry.
just need to pay attention, yeah.
So there's an abbreviation or acronym that can be used for sepsis, which is S is for slurred speech or confusion. E is for extreme shivering or muscle pains. P is for passing no urine in a day. So that's a worrying sign as well.
Definitely.
Kidneys have got to function, haven't they?
Definitely.
Yeah. And the other next S is for severe breathlessness. It's really, the I is, it feels like you're going to die. And the S is skin, mottled or discoloured.
I was just about to ask because the lady said she had seen discoloured around the area that she got bitten,
yeah.
Yeah, but you know, so it's so ironic because with her stories that the bite that she got, I don't know how to work it out, but they lead the bite to an untreated infection. So could it be that the bite, well, she did specifically say it's an yeast infection. I think
a yeast?
Yeah, I think it's a yeast infection, vaginal infection.
Oh, yeah, okay.
Right, so she's specifically, but why happened when she got the bite? Because they had to air ambulance her back to the UK.
Okay, well.
You know, and she lost all her limbs.
Yes, that's the problem about sepsis.
So how fast sepsis can spread though?
Again, varies from case to case, depending on the severity of the response by the body. But yeah, as I say, it's a medical emergency. That's one thing an ambulance should not delay in collecting a patient with if we suspect it's sepsis. And bear in mind the person's at home with their mother or their grandmother or their brother or sister.
Right.
Who's thinking, well, you know, they've got this symptom, they've got that symptom. Who do I call? Do I call the GP? Do I call 111? Do I call A&E? Do I call 999? And all that takes time to process. So what I was saying to you is that it's a medical emergency. If you've got any suspicions that it might be sepsis, you need to act on it very quickly because it can spread. We sometimes say in children within a few hours. Yeah, so I'm an out-of-hours GP, so we deal with these cases sometimes, and we have to get that person to hospital as an emergency.
So who is at risk for getting sepsis?
Yeah, who's at risk in particular? So I'd say the children and the elderly and those with immune conditions, you know, low immunity, and those people who perhaps have things like renal disease, kidney disease, people who have diabetes as well. Those people tend to be at slightly higher risk than the average person. So people with cancer as well, people living with HIV.
Mm-hmm.
Women who've had babies as well, in that short period after having given birth, they're also at risk, unfortunately.
Oh.
Yeah.
Oh, okay.
So I'll just repeat that then. So babies and children under 5, people over 65, and those with a weakened immune system. So there are quite a few people like that. They're like cancer patients because the medication they're taking impacts on the immune system. People living with HIV, people with chronic conditions like diabetes or kidney disease, and women who are either pregnant or recently given birth. We call that period after giving birth a puerperium, when lots of things can go wrong. You've given birth, you've got a lovely baby, that 9-month wait is over, but that period after birth is a very, very important period of time. Those sort of 4 or 5 weeks.
Could that be some of the reason why a lot of women, the doctors would probably check their placenta just in case if there's any fever or anything like that?
Yep. So when you give birth, obviously some people are giving birth at home.
Yeah.
Some people are giving birth in special maternity units, some are giving birth in the main hospitals. But yeah, the professionals looking after you check certain things, certain criteria. The placenta's checked just to make sure it's complete, and I've actually done that work myself. You take the placenta, you spread it out on the surface, and you make sure there's no bits of it missing.
Oh.
It's like laying out a large pizza.
Okay.
It's that sort of size.
Okay.
And you're going to make sure there's no sections missing, because that section that's missing could be inside the woman. And if that's inside, that can increase the risk of an infection.
I want to, because of time,
Yes.
I want to fast track my questions.
Sure.
But before, this question is really important to me. Like, is there a way that we can prevent ourselves from getting sepsis? And if we identify sepsis, what are the steps that we should take?
Okay. So prevention, that's a word that we know a lot about now as well. Good hygiene. So keeping wounds clean. If you get that cut, clean it with the alcohol. Keep an eye on it. Cover it with a dressing if necessary. Then there's vaccinations. I know that's a sort of ambiguous topic, yeah. But vaccinations are there to prevent, guess what, infections. Because we've known over the years that many types of infections have led to large parts of the population dying, whether it's or getting serious illnesses, Then early treatment of infection. So you've got a cut, it's not healing, it looks oozy, it's oozing something, or you've got a chest infection, or you've got a urine infection. Get that infection treated early. Don't just sit on it and keep an eye on it. The whole point of medicine, really, God's given us this gift to be able to make medicines originally from herbs, and now obviously much more sophisticated, but it's to fight the infection more aggressively than your body can fight it.
Okay.
So also the hospitals have to be very careful about how they manage infections as well, because some infections only occur in hospitals because it's that environment where the common organisms don't survive, but the rare aggressive organisms do survive.
Oh, okay.
So they have to be very careful to manage infections in hospitals. And also, sometimes we're giving out antibiotics more than we need to. So people get a slight cough, it's actually a virus. But they're begging the doctor for antibiotics,
Is it
I
true?
need antibiotics.
Is it true that our body should only take up to 2 cycles of antibiotics per year?
It's a case-by-case basis.
Okay.
Maybe that's the ideal for someone who's perfectly healthy, but if you're an asthmatic or you've got chronic obstructive pulmonary disease, you might need more than that to keep yourself alive.
Okay.
And don't forget, so everyone's immune system's different. Any other fast-fire questions?
So, in your knowledge,
Yes.
do you know of any case where people would get fully recover from sepsis?
That's a good question, because sepsis is not only a physical condition, there is also a psychological element to sepsis. When you, like I said to you, one of the things is that you might feel that you're going to die.
Right.
So with that feeling, you may well end up in A&E, in an ambulance, 999, blue lights, and then be in hospital. You might even be put into ICU. And, that near-death experience can actually be quite traumatic.
Yeah.
And some people get a post-traumatic stress disorder from sepsis.
Yeah.
So I've come across people who've lost fingertips or their nose, and as you mentioned, people lose their limbs. So I wonder if the recovery, there must be some research out there, I suspect, that talks about whether you ever fully recover from sepsis.
Yeah.
Because what then happens is the next infection you get, you're worried straight away that it's going to also lead to sepsis. There's something about your body that reacts to a common infection in an extreme way that another person wouldn't react to it. So you're going to then be worrying about the next infection. I get that. People say, I've had sepsis 3 years ago, I'm worried about this new infection.
Right.
So do you ever fully recover? Great question.
Yeah. So that was supposed to be one of my first question, whereas, what recommendation would you give as an advice for someone that's going through post-sepsis? Like, what would you recommend to them? As you said, it can be a traumatic experience as well.
Yeah. I mean, you're relying on your network, so you're relying on your family, your friends, your church. You're relying on your relationship with God if you're a Christian, and trust that God will get you through this situation. You might also be relying on your work arrangements, your employers, to be understanding that, you've got over the worst of it and you're hoping to come back to work, and work is an important part of your identity, So I hope that answers that question. So sometimes just keeping that network around you is really important.
Okay.
So be nice to each other, be nice to people, because you never know when you're going to need them,
So the last question is, what is the biggest misconception and myth that surrounds sepsis that you hear?
Is there one? Well, I did say it's the hidden killer. So what I'm going to say is it's not always obvious that you are heading towards sepsis. So if it doesn't feel right, whatever it is, don't delay when you've got an infection. If it doesn't feel right, don't delay. It's not going to be an obvious, sign. It's going to be subtle, an accumulation of several subtle different things, which can only be picked up by medical professionals, nursing professionals. Okay. So I'd say don't think it's going to hit you like a bolt out of the blue. Be suspicious, and if it doesn't feel right, get it checked. It's a hidden killer. Okay.
Dr. Jackie, thanks again for another informative podcast. As you know, we have a tradition closing, of opening and closing tradition. And our closing tradition is the guests leave an encouraging word for the next guest coming up, not knowing who that guest would be. And your encouraging word comes from a herbalist that I've interviewed last. Her name is Violet. And she said, weeping endure for a moment, but joy comes in the morning. And when she sent me that encouraging word, I said, you know what? This is a woman of God, so I think this would definitely fit well with her. So thank you again for coming in. And as you know, you probably write your encouraging words, or you can probably send me a text message for the next guest coming up.
Yeah, I'll send it through.
Okay, thank you. Thank you once again for the NEC to allowing us to host this podcast in studio. Studio is available for especially for Adventist members to use, and it is also open to the public. You can contact them on the information that I will be listing on the screen. Until next time, stay safe, stay blessed, and eat healthy.